Hello and welcome to the Dental Labcast. My name is Jenna.
My name is Andrea.
Please follow and subscribe to support our show and to make sure that you never miss an episode.
Welcome to the next episode of the Dental Labcast.
So hello and welcome. Today we've got Julia Glancey. Tis Glancey, is that how you say it?
Yes, it is. Yeah.
Perfect. I did think about that at first. I thought, should have asked her really.
No
Thanks for
worries.
joining us today. Really appreciate
thanks for having me.
And before today, I don't think we've actually spoken kind of a while, have we? I think the last time I actually saw you in person was at Dental Show maybe 2 years ago.
Yeah, it was. Yeah, because I wasn't there last year, unfortunately. So it must be a good 2 years since I've spoken to you.
Have you spoken to Julia?
We've spoken over social
Like
media.
messages.
Yeah, but not face to face or anything like that. So it's really nice to actually hear that really relaxing voice again, which I'm sure everybody has said.
Sultry tones.
Got that lovely relaxing
the sultry
voice.
tones of Julia Glancey.
Yeah, you could start your own podcast, really, I think.
Yeah. Well, for all you stressed techs out there, you see, I should just do something, when you're having a bad day, you can then just listen to it and calm.
Oh, I'd definitely listen to it, definitely.
We could get you to do that film tape.
Yeah.
That's showing my age saying tape, isn't it?
No, I've had tapes.
8-track.
So we're going to get into how you got into dental technology, but just tell us quickly from the last time I saw you, what have you been up to in the last year or so?
So I have changed positions. I now actually work as a fully remote designer from home. I work for a laboratory called Chorus 3D. The lab is based in Northern Ireland and I'm over in the UK, but we specialize in a system called Guided Smile, which is an American company, and they are all about the guided implant restorations and the big all-on-X rehabilitation and all of that sort of stuff, really. So yeah, I've spent the last year being fully digital. These hands no longer see any dust or acrylic or get battered every day in the lab,
And how do you find
miss
that
aspect of it?
Do you know what I do? Yeah, there is part of me, my lungs don't miss it, to be fair. But I do miss the full kind of workflow of it all. Because I was very used to taking cases from beginning to end. You become very familiar with that case, and being able to take it from the foundation to the fully finish is a very satisfying way of doing it. But now I'm part of a whole line of people that kind of touch these, because at the lab we are fully serviced. And I have to say that that James, the owner, he has made huge investments into getting all of the latest equipment and everything he needs to be self-sufficient within the lab. So we don't actually really outsource anything anymore on the manufacturing front. And he has metal printers, milling machines, all of it. So it just means that we have full control over every aspect of the case, which helps it run a lot smoother,
Sounds really good. We will come back to that because we definitely want to talk more about the implant guides and the all-on-4s and things. But so let's get into how you got into dental technology. And, you started as a dental nurse, you said.
I did, yeah.
Yeah.
So I spent, it must have been on and off about 8 years in clinic as a dental nurse. It was a very organic sort of process. Basically, my dad was a dentist and he had his own practice. And I was in college at the time, and I was just going in to have my summer break. And one of his nurses had an accident and had to go off sick. So he called upon me to just come in. He said, "Look, the girls will show you what to do. I just need some help for a few weeks."
Just to help him out.
Yeah, just to help him out. And he trapped me, God damn it. That was it. Yeah. So
no going back from there.
No. Well, do you know what? I found that I enjoyed it. It was a time in my life where I wasn't 100% certain of what I actually wanted to do. I knew I wanted to kind of go into sort of some kind of medicine, and I'd worked in the local hospital theatres, just doing some like healthcare support work and things like that. And I loved being with the patients, to be honest. I love just being able to calm them down and have a good old chat. And because you know what it's like, so many people are dental phobic. It's kind of a hated industry by the general public. So I liked that kind of challenge of it, of just being able to make people feel safe,
I get a lot of people walking. So I work in a clinic sort of one morning a week, supervised environment, etc. But the amount of people that come in and just say, I'll say, "You're all right." They'll go, "No, I hate dentists." And I'll just go, "Oh, it's a good job I'm not a dentist then, isn't it?" Come on in. And, to have them relaxed and smiling as they leave. But, in a dental clinic setting, having a nurse who can put you at your ease thing is just invaluable. It's honestly,
Yeah,
it's like they are. I honestly believe they're one of the key roles in the dental practice. They're the
Massively.
one.
100%. They're definitely, they can be undervalued, I think, um, and
Absolutely.
underutilized as well. There's a huge opening for clinics. The previous lab that I was at was based in an implant center, and actually they have nurse practitioners there. So they've trained their nurses to take on roles where they run their own clinics. They do assessments, they do all of the intraoral scanning, they take impressions, and, they really utilize their nurses to a high degree. And I have to say, their impression taking was a hell of a lot better than the dentists were.
Yeah.
But it's just because they've got that eye for detail, and they do have more time. It's about spreading the time that you've got available and the hands that you've got available in the right way, really. And you can really kind of enhance your business by doing that, I think.
Yeah. They're really conscious of trying to just do a good job, aren't they?
Yeah, yeah, most
We've been
definitely.
training some at our place to do the intraoral scanning, and they'll quite happily come and just say, "Andrea, is this okay? If not, why not? What can I do to make it better? Have I got everything you need?" And they're really, really dedicated to try and make sure that they've just got the very best, not just for me, but so the patient's not getting messed about, not having to have rescans. And yeah, yeah. I love working with dental nurses because, they really care and they're really good. So I
Yeah,
imagine you,
100%.
especially with your sultry tones, was a great dental nurse able to put people at their ease straight away. But they were falling asleep in the chair with you on the other side of them.
Yeah.
Or just waffling their ear off, that's the thing. But it is, we're asking people to trust us. But we're asking them to do it in an environment with a load of weird noises, weird smells, with all of the different chemicals that are going on. And also, they can't see what's going on. So, they're laid back in a chair with their mouth wide open, a bunch of strangers' hands in there. No wonder it's kind of a
Very
bit of a
vicious.
uncertain environment
Yeah.
of like, what the hell are you doing to me? So I just found that just explaining exactly what was going on, and for the little kids, you'd hold a mirror up so they could watch what was happening. They could actually see that it wasn't anything dangerous or anything to be scared of, basically. So
Even
yeah, I really enjoyed it.
as a just a patient myself and working in dentistry, even when I'm in the chair and I go and see the dentist, I get those intrusive thoughts and I'm like, what do they think? Can they see all the hairs on my nose, or do they think about,
Have I waxed that, Tash?
yeah, yeah. Have I brushed my teeth well enough? Have I got food stuck there that I've missed? Or should I just say something really stupid, even though I've got my mouth full of, what they
Are you
call
one of
the
those that try and
suction
talk
things?
when they've got a load of stuff in your
Yeah,
mouth?
I am one of those. I've bit a dentist's finger before by accident because I was trying to talk. So
But again,
oops.
it's a nervous thing, isn't it?
It
When
is,
we
yeah.
get nervous, we either retreat or we waffle.
Yeah, I'm not a fan of going to the dentist. I don't really like people looking in my mouth. It's a very personal space, isn't it, really?
Yeah, it is, and it's you're letting somebody in, and like I said, especially for the general public as well, they don't know what we're doing. So that's why I always thought the best way was just explain it
Mm.
in
So
simple terms.
Yeah. So where did you get from being a dental nurse to then saying, I fancy being a technician? Where did that transition come in?
So, I mean, I kind of worked my way through the years, did my training, and then got to the point where I was training other people. I was running a group of nurses. And for me, it was just, I loved being challenged and I love learning and I love progression. So I got to the point where I couldn't progress anymore as a dental nurse. And there were a few avenues open, whether it was to do hygiene and therapy, to go into practice management, or become a technician. And I love working with my hands. So, and I hate paperwork. So I was like, practice management's not for me. All of that politics, I'd rather leave to one side. But I love leadership. I love that. I love being able to take a team of people and helping them run and do the best job that we can do as a team. But it just wasn't enough to just do that on its own. So I actually transitioned, and there was a local lab near where I was living that needed a manager, basically. And I just went in there and I spoke to him and sort of came to an agreement that I'd never run a lab before. So a lot of people were like, how on earth did you go into kind of managing one if you weren't even a technician or anything?
That's pretty good,
But
to be fair.
what I said to him was, I will come in and I will manage people and I will manage the workflow and we'll take it from there, basically. And so that's what I did. I actually managed the lab for 4 years. And then whilst I was there, it was a busy NHS lab. So it was all hands on deck. The guys showed me how to do certain things so I could jump on the bench and help them just with like bite blocks, special trays, mouth guards, that kind of thing. And then I realized that I really enjoyed what I was doing. So I decided to step back from the management and actually fully train as a technician.
And do you feel like with your nursing side of it that helped you become a
Oh, massively.
technician? Does it make a difference if you've been a nurse before and you've got that clinical
Yeah.
experience?
Yeah, for me it did personally, because I have an insight to the other side of things. As we know, notoriously, there's always been a kind of unspoken feud, or in some situations, spoken feud between clinic and lab. So being able to actually understand the challenges that there are clinically to then what the challenges we face as technicians are really helped bridge that gap, and also being able to see in real time how things like extraction sites heal, the difficulties when someone has a collapsed OVD, how the mouth moves, how the masticatory functions move, actually physically there watching it really helped me when I apply that to doing restorations and planning what appliance fits where and why it's suitable and things like that.
Some of the best technicians I've met have been trained dental nurses as well, for all the reasons you just said, being able to see both sides of the coin and understand how one affects the other. And I think when you mention sort of feuds or that sort of little bit of rivalry or not quite getting on, and I think it's usually just a communication issue. And it's just misunderstanding in communication. And I always say to any trainee dentists or anything like that we get through, as soon as you get in your own practice, first thing you do is find out who your lab is. Give them a call. If they're local, just say, can I pop in and see you, have a look round, and start to build those relationships. I says, because if you get on really well with your technician, you're going to be able to do some amazing work for your patients, because you're going to just be able to bounce off each other. But yeah, some of the best technicians I've seen have also had that dental nurse training. They do make excellent technicians. I don't know if any
Yeah.
that's actually gone from technician to nurse, though.
No, I don't either. No, I
I
don't
know
either.
someone that went from nurse to technician to back to nurse.
Did you?
I know 2 people actually that's done
Did
that.
they not enjoy the technician side?
I think they did. I think they missed. It was more of a case of missing the clinical side.
Yeah.
So
Yeah.
I can see that.
And I think that's one of the things that really helped me, is because when I went from managing a lab to then training at the first lab that I actually worked on the bench at, it was based in a clinic. So I still got my clinical time. Yeah,
Is
all we had to do was run upstairs and we were in the surgery. So it really helped bridge that gap. And then after a while of being there, I then had patient consultations. So we were doing big all on X same day smile surgeries. So instead of the dentist taking down all of the notes, then coming down and telling us, we would actually meet the patients ourselves and find out firsthand exactly what they were looking for with their new smile.
and that
And it really, really helped. Just being able, because I
Trying to have
find,
expectations.
yeah, but also watching how their mouth moves. Because it's all good and well, photos are brilliant, don't get me wrong, they are amazing. But it's like when you ask a patient to bite together or you ask them to smile, it's like they've never bitten together before in their life. They don't know what they're doing. Their mouth's going like this. And then you ask them to smile naturally, and it's the most unnatural thing ever. They're like, you know. So actually just having a conversation with somebody and watching how their mouth moves, watching how they laugh, watching how they speak, hearing how they speak can really help you being able to put together the right kind of smile, whether it's what mold of teeth that you're doing.
kind of already planning there in your head
Yeah.
whilst you're in front of them before you've even got anything in your hands to work with.
Yeah. And especially when it comes to these big cases when you're dealing with osteotomies and bone removal and stuff, where those transition lines are going to be, how you can assess that, how much space you're going to need, what freeway space are we looking at? And it's all things like that are invaluable and really help you as a technician come back to the bench and be able to put those things together.
You have a lot of experience, especially clinically, and you've, with your all on fours and your implant planning and CAD CAM. How do you think that is different? Do you think a normal technician that hasn't got that clinical experience can learn or come to the same sort of knowledge and experience that you have, or do you think they still need to have that clinical side? Do you think there's obviously the more clinical benefits to it that outweigh?
I mean, I think it all depends on what kind of technician you are. I know some fantastic technicians that don't have any clinical experience, but what they do is they communicate and they listen and they train themselves, and they are really applied to doing the best job that they possibly can. I think if technicians have an opportunity to get some clinical experience, then most definitely it can only add to their skill base. Is it a necessity? I don't think it's a necessity, but I think it can be a massive advantage, definitely. But like anything, it all depends on how dedicated we are to improving our own skills. I think sometimes it can be also checking our egos as well, be slightly closed off. And actually, if we just open up to listening to all the elements that are involved, it can really help us improve our skills and our abilities as technicians. I mean, I'm somebody, I ask so many questions. Like you could ask me, you could sort of call me just a bit of an ask hole, to be honest, because and especially when I'm learning something, because I want to know
You want to
why we do
understand.
certain things.
Yeah.
Yeah, like fully from all elements and from all angles. I want to know, why is it like this? What's this about? How come it's like that? And I've, over the years, that's what I've done is I've just asked questions, whether it's to the clinicians I work with, the fellow technicians I work with. I started as a prosthetic technician, but I wanted to know about crown and bridge. I wanted to know about implants. So I asked the people that I was working with why they do certain things, why they choose certain types of occlusion, why they choose certain types of materials, and really educated myself on all angles and all aspects.
Did you find that easy asking? Because I'm one of those, I ask a lot of questions, and anybody that knows me knows I ask a lot of questions. But my answer to that is, if you don't ask questions, you don't find out things.
Exactly.
So How did you find that experience of asking questions? Because you see some people, when you go on social media and things like that, you see some people commenting in these groups that they're a bit frustrated at their lab and they want to learn more. And some labs don't want to show them how to progress a little bit more because they're worried they're going to go off and work somewhere else or set up their own lab. How did you find that when you wanted to learn more? Was it welcomed with open arms, or did you find any kind of friction anywhere?
Do you know what? Again, I think I was extremely lucky with the people that I worked with. For starters, I worked with a specialist prosthodontist called Matt Rose. Lovely, lovely guy. And he, I owe a lot of my knowledge to that man because he gave me a real good insight to the clinical side. And he spent an awful lot of time with us down in the lab explaining certain restrictions and why we needed to focus on other bits and pieces. And, he was an old school dentist as well. So he wasn't scared of picking up the handpiece. And I didn't wince every time he picked it up thinking, oh God, don't butcher it. Step away from the burr. He was he is a very, very talented man. And I was also lucky that the guy that I worked for, John Dolding, he, again, an experienced ceramist and very knowledgeable guy. And he just had a lot of patience. He was a very good teacher, had an awful lot of patience, and he taught me a huge amount. And, I still utilize what those guys have taught me to this day.
So when you've gone from a nurse, well, you've just gone from helping your dad out, becoming a nurse, and then going into management, and then coming into a lab, going on to a technician. You said you started in prosthetics, and then you went on to implant restorations. Did you kind of know that you was going to go that way? Is this just things that fell into place because there was doors that opened and you was inquisitive with those, or did you kind of already know that, oh, I want to do implants?
No, it was something that grew organically, to be honest. It was the doors that opened, and I looked through those doors and I saw certain opportunities and I went for them, basically. And because of my thirst for knowledge, it's just moved me on organically as I've gone, really.
And if you had some advice for a new technician coming in to do some sort of implant work, what advice would you give them as to where to start? So, say if I wanted to learn more implants, because I'm a ceramist, I knew a little bit of CAD/CAM, don't really know how to design implants on CAD/CAM. What would you say to me as to Jenna? This is where you should start. This is what you need to focus on first.
I mean, depending on what sort of situation you're in, what I would say is look around you, look at what other people are doing and source those avenues, basically. So say as yourself, you are a ceramist, but you want to learn more CAD, look at the technicians that are available that you can go and ask these questions, that you can spend time with, because a lot of my learning was done at the bench, making mistakes and, trying to find my way out of problems and with a good group of people around me. But a lot of it has been done in my own time as well, in the evenings and weekends and just, picking up and certain resources like going online, social media, YouTube, just, general textbooks, just having conversations with people, kind of utilizing everything that is within my reach, basically.
I think me and Andrea was
I feel
sorry.
like I was going to say, do you also feel like that people are more generous with the knowledge now? Back in the day, there seemed to be a lot more people who'd go, "Oh, knowledge is power. Don't ever teach them all what you know. You got to keep it to yourself." Whereas now it feels like the community is a lot more forthcoming with their knowledge. They're happy to teach and train people, and also the resources that's available on, the internet, all these sort of videos and content that people put. Even just seeing a picture of somebody's work where they're saying, look at what I've done, isn't this brilliant? You can learn so much just from seeing what other people have done, can't you?
Yeah, I think it's massively changed, to be honest, because, When I started in dentistry, it was very much like that. Keep it to yourselves. We can't share this. This is our formula. This is for us to make money with. Whereas now people are realizing that knowledge is power and knowledge is imperative for us to be able to progress. And people aren't as tight-lipped about those things now. They're more than, you still do get some people, and that's fair enough. They've spent a long time educating themselves and getting themselves to that point. But now I do believe there's big communities of people. I mean, night shift is one of them. I'm an ambassador for night shift, and you can see how much those guys really want to empower people and share that knowledge, hence why they share the cases of the week. And it's not somewhere where you go to just badmouth something or have a rant about something. It's about empowering technicians and being like, oh my God, I found this amazing material. It's for all of us dental geeks that just love what we do and
saying
want
it's
to
okay
do it
to
more.
have a voice.
But there's
Yeah.
in sharing that, isn't there?
Yeah, and I think social media has become very powerful to actually get that out there because it's so easily accessible and you can reach a lot of people all in one go. And there's a massive surge, even outside of dental, of these influencers all going online and sharing things from health to food to, dental and things like that. I think it's just took a big surge over the last couple of years.
Yeah, and that's the good side of social media. We all know that there can be a negative one, but actually if we draw on those positives, because the amount of people that don't have the knowledge that we do, that we can share, and we'll use turkey teeth for an example. Everybody slates turkey teeth and, oh my God, never have your teeth done in Turkey. I don't actually agree with that because there are some really good clinics in places like Turkey. But unfortunately, there are some really bad ones. But just like in this country, there are some really good
Exactly.
clinics and there are some bad ones, so
The danger and the warning is there because I completely agree with you on that point as well. It's more the fact that if something does go wrong and you're here, we're not going to put it right for you.
No.
We will get you out of danger. We'll make you safe, but we won't put it back. That goes for any work that's done abroad. I used to work in a hospital and we had a lot of people who come in with failed breast implants and, they'd have the surgery to make them safe, but they wouldn't put the implants back. And there were a lot of people who used to kick off about that. And I think that's the danger with the turkey teeth and going abroad for any procedure, that if something happens here when you go back home, we'll make you safe, but we won't give you back what you've lost. So that's
no, what security have you got? What backup have you got? But it's things like that you can spread that word. You can utilize social media and let people know that as long as you've done the research and it's a reputable clinic, then that's great. But also understand if anything goes wrong with it, it's that clinic's responsibility,
but
not a
some people
dentist that you see
actually
here.
choose that look that we're going, oh my, as technicians, we're looking and we're going, oh
Yeah,
my goodness, that just looks awful. There's nothing
yeah.
natural looking about it, and we'll
No, it's like
criticize it
white
to
piano
hell, won't
keys.
we? But
Well,
some
I actually
people
have a
love that
friend.
look. That's what they go for, is that look, don't they?
Yeah.
I have a friend who has actually, I think it must be about a year ago, might even be more now, that actually went over to Turkey and had her teeth done. And she messaged me and asked my opinion first. And I gave her my opinion. I said, personally, I wouldn't. And these are the reasons. The reasons are being that if you did have any issues, if you come back over to the UK, a UK dentist probably wouldn't touch you and fix that because they don't know, you know, what's been done and what's going off, and they wouldn't want to take responsibility for that. And you'd probably have to go back over to Turkey. So you have to think about fees and flight money to get back over there if you need any work redoing. Luckily, as far as I know, she's had no issues. But again,
Yeah,
it's one
but
of those things is that you do get sort of issues in the UK as well. It's not just
oh yeah, 100%. 100%. And as technicians, we receive these impressions and we're asked to do certain things. And ethically, you kind of go, really? You really haven't thought about that. And I think as techs, sometimes we can be very wary about using our voice to say, no, I don't agree with this. But, we are GDC registered. We are held to the same accountability that the dentists are. So, personally, I view that if I don't ethically agree with something, I'm not going to then go ahead and do that. I
No,
will be somebody that kind of stands up and says, I don't think this is appropriate. I think we need to look at another avenue.
but that's where that communication and, teamwork comes in that we were talking about earlier, isn't it? Because if you've built a relationship between lab and clinician, you can then have those honest conversations and go, look, you've sent me this through, you've asked for this. It really does not, it's not appropriate on this, or it's not going to be stable, it's not going to be safe. And can we look at some alternatives? Have you thought about this, that, and have those informed conversations where you're both playing to your strengths and your knowledge and you've got that mutual respect.
That's it, isn't it? The mutual respect. I think
Yeah.
I think there's some amazing dentists out there, and we have amazing relationships with a lot of our clients. But there is still the odd ones out there that you struggle to find a balance with. And I think sometimes as well, you've got issues with them not fully understanding materials and what you can and
Yes.
can't do with them. So if you've got a client that's willing to communicate well with you, you can explain that and they're like, we want to work with you. What can we do and how can we change it? So I think we've got a better voice now than we used to. But I still think, do you
Yeah,
think it'd be
definitely.
good for dentists to, like you say, come into the lab and have a look at how things work and, understand materials better as well?
Yeah, yeah. But I mean, in this day and age, they don't have to come into the lab. It's like this afternoon, I had a consultation with myself, my colleague Lola, and one of the dentists because we were planning it's going to be a full arch surgery with some composite build-ups and a couple of restorations on the lower. And the dentist that was actually planning to have the composite side done with another lab because he wasn't aware that we could do those wax ups for him with us. But when you split a case like that, you inevitably are going to end up with problems. So we had a half an hour video call with him. I shared my screen with him. I could show him the digital design of what we were planning. Lola talked from her point of the restrictions she had for plotting the implants. And, by the end of the half an hour, we've now ended up, we're actually doing the whole case so that it goes smoothly. He's fully aware now of why this is the better option because actually the patient needs to have that stable occlusal platform to be able to support the work that we're doing. Yeah, half an hour out of my day has prevented potential kind of catastrophic things happening with the temporary bridge to the implants that are freshly placed. And it's just the meeting of the minds, basically, because we're all in dentistry. We all speak the same language. We're just talking different dialects. And it's about understanding each other's dialects and listening to one another that can really help. And, don't underestimate the power in that, in the sense of what it can do for the case in general, what it can do for a time factor, for a monetary factor. It has a knock on effect to all of it because we all know how much of a pain it can be when we start having problems. You're losing time and you're losing money. And those are two things that clinicians and technicians both struggle with,
Yeah.
because we have close margins on things and we're all very busy. So, when you're losing time, it can be, it means the difference between you being able to go home at a reasonable hour or you're spending the whole night at the lab. So
Not what you want to
it's
do.
no, and it's what I find is a lot of people just look at the here and now. And actually, if we look at the bigger picture and take into account the end and take into account, okay, actually, what's 15 minutes out of my day to have a video call with somebody? We can all go, no, I'm too busy. I've got boxes all around me. I've got too many cases. But actually, I could be saving myself another 2 hours in 2 weeks' time when something's gone wrong with that restoration and I have to fix it.
It helps manage all of those expectations as well, doesn't it? Like, and on so many different levels.
Yeah, 100%. 100%. And because we are so busy, we all fall guilty to becoming very tunnel visioned. And like I said, just looking at what's in front of us. But if we just take that time to just look a little bit beyond, we can actually save ourselves a massive headache.
Yeah. To the all on fours now. So anybody that doesn't understand or know what an all on four is, can you just explain what is an all on four and, why they're so complex?
Okay, so the basic way of putting it is it's a full arch or full mouth restoration, but instead of it being tooth borne, it's implant retained. There are 3 different types, but the 2 different types, the most popular are FP3 and FP1. FP3 is where you have teeth and pink gum work, so you have a full height bridge, or FP1 is where it is just tooth and you do your pontic restorations and then your implant sites as well. It's really popular because it's a very good way of restoring broken down dentition on all on 4 or all on 6. Some do 7, some that, hence now it's kind of being referred to more as all on X because some dentists prefer a certain number of implants and some prefer others, but it's a really good way of being able to restore somebody's dentition in a very sound and reliable way, basically.
And when you're doing an all on four case, how do you initially approach that when it comes to planning and things?
So I will take into it what we ask for is a full set of impressions or scans. I will ask for full face photographs, up close photographs, retracted. I will ask for all the information that you can give me. I will then take those scans and I will assess. I will look at the wear on the teeth to whether, I want to know why are you coming to have this restoration done? Why has your dentition broken down? So especially when I worked in clinic, these are the questions that I'd be asking the dentist, the questions that I'd be asking the patient one-on-one. And I'd be looking at all of those reasons to help me evaluate how I'm going to approach the case. And what I mean by approach the case is what materials I'm going to be looking to restore the definitive in, how I'm going to be looking to set up the occlusion and what kind of guidance I'm going to be restoring it on. And generally, what kind of restoration is fully sort of appropriate for that case.
And do you find what's your biggest challenges that you find when doing these things?
Generally, if you've got a shorthand with the dentist that you're working with and you've been doing multiple cases, then again, things flow a lot easier. If you're working with a new clinician, the challenges can definitely be getting their understanding of where you're coming from and what you need as a technician. Understanding that we have certain height restrictions, there's certain limitations when it comes to different types of occlusion. You don't want to be locking a patient in. So if you're using like group function, you don't want to be locking that patient into somewhere because you're dealing with a restoration now that there are no receptors anymore. So the receptors in our mouth, the periodontal ligaments, they give us the signal of when we're biting down too hard, if we're grinding our teeth. When you're moving a patient onto implants, they've lost all of that. And you'd be amazed at how strong those jaws can smash together without the patient even realizing. So you're kind of taking in all sort of different aspects into account when you're looking at restoring these cases.
Do you ever find that you've got clients that kind of want all upfront costs and things like that before you actually know what you're going to use? Because obviously, when you say that you need to plan to use different materials when you're assessing these cases, materials are all different prices, aren't they, depending what
Yeah.
sort you need to use. So do you ever find issues there where you're kind of battling with a client that you can't kind of give upfront costs? You can give an estimate, and they're trying to kind of keep you at a threshold, so to speak.
Yeah.
And you're like,
Yeah,
it's,
because, you know,
there's
Voice of experience speaking there, Jeff.
yeah. But because it does all boil down to money, you know, generally it does boil down to money. And yes, 100%. But again, I do understand why they want to know those prices, because they obviously have to charge the patient.
And they have to make sure the
So
patient can afford it.
yeah, you know, if all of a sudden you're going to be like, do you know what? Actually, we've done the temporary, we're going to restore the definitive now, but we've just realised that we can't do this out of acrylic or PMMA. We're going to have to use zirconia, or actually, this is going to have to be a full PFM build-up. You know,
and there's a big price difference
there's a
in,
huge
from
discrepancy. Yeah, because on our side of things, one, the materials is a difference in cost, but also it's the time. You know, designing and milling a PMMA to designing and milling a zirconia to doing a full PFM build-up, there's a huge, huge time difference in that. So therefore, the price is going to be different. So that's why I ask so many questions, because there's no way, if somebody's lost their teeth due to, say, bruxism, I'm never going to be offering you an acrylic wrap or a PMMA appliance. It is never going to happen. You know, I'm going to be looking at something stronger. I'm going to be looking at a zirconia-based restoration. So I already know that your definitive cost is going to be a lot higher than what it would be if we could do a PMMA, for instance.
if you find a dentist can't do that, or the patient can't afford that, is that something that just stops from there? Then do you say, do you turn
No,
that
we
kind of
look at
work
different
away,
options.
or
No, look at different options. You know, look at every different avenue, whether it be okay, actually, because sometimes, you know, we find this as well, that dentists come, they want a fixed solution, but not every case is appropriate for that. And actually, there is nothing wrong with a good old overdenture, you know, in a lot of cases, there isn't. And it's not necessarily massively cheaper, because you're still talking about implant bars and you're still talking about high end work, but it can be a solution for cases where actually the transition line is going to be unsure if we do a fixed, and nothing's going to be able to hide that, like a flange of a denture, you know. So it's understanding. The first thing that I kind of look to is understanding the limitations and the obstacles that we've got in each case, because they all come with their own challenges and obstacles, and it's understanding the best way around that for all parties concerned, you know, that being suitability, because obviously for the patient, the main thing for them, 9 times out of 10, is aesthetics. Now, to me, aesthetics is massively important, but it's not number one on my list.
But
You
if
know,
you make something and it works great, but the patient thinks it looks ugly, they're not going to be happy, are they?
no,
They're not going to
no,
want it regardless, because that's
no?
going to affect how they look, how they feel people's going to respond to them. It's going to have a really significant impact on their self-confidence, esteem, and life in general. So for us, functional
yeah,
is always the important thing. But I mean, I'm sure we've all made just a top set of dentures for someone before, and the patient wasn't bothered about the bottom ones for some reason. No, I don't need the bottom teeth. I'll
yeah,
just have my top one.
yeah. I'm like, how do you eat?
I just want it to look like I've got the top teeth. That's
Yeah,
what the
but it's
patient wants. Doesn't always marry up with what we think is best, does it?
yeah, but again, in cases like that, it's about patient management,
Mm.
and it's about, you know, we can look and go, well, that's the dentist's responsibility. But actually, I believe it's our duty to help the dentist manage the patient, because we're all in this together.
I always
I can't do my job without them, and they can't do their job without me.
no.
So,
Do you find you
you know,
have this triangle all the time of, between dentist and client as well, that you've got um, they want quick, cheap, and high aesthetics,
yeah,
and
and
you
you
can't
can
manage
have all
all of
three.
those.
Yeah. You can get close to it though.
Yeah,
And again, that's, once you understand the premise, once you understand what your aim is, for me, it's cleansability, form, function, aesthetics. But I want a good result for all of them. But I also know to get all of that, it's not going to be cheap as chips, so, but I'm not willing to compromise on any of that either. So I will never force a dentist into a situation, but I also won't do anything that I don't think will be best for the patient outcome either. So it's about kind of,
and that's your experience as the technician as well, isn't it? That the
yeah,
dentist has to trust your opinion, and that's what you're there for. That's where it becomes that teamwork and the communication.
But that's why it's also important for the technician to actually be in the room with the patient sometimes. When it's a complex case, I've been involved and I've seen other people be involved in cases where the dentist and the patient's really having this conflict between what the patient wants and what the dentist thinks they should have or thinks that they can afford or whatever. There's just some, misunderstanding between them. And then you bring the technician in, the technician can sit and explain what is possible and what isn't and why that is the thing. And sometimes just bringing that extra person in the room with that knowledge to be able to explain it or say to the patient, okay, tell me what you need and I'll tell you if I am able to make that, if that is actually possible, if that's sensible, and if it isn't, I can tell you why. And I've found quite a few times that the patients are really, really respectful of that. They really appreciate that.
yeah, they respond well to it, because again, they don't want to be lied to, you know.
I had a patient who refused to see the dentist from that point onwards. Every time she came in for a replace, it was just a bite raising appliance. It was very simple. But every time she needed a replacement, they'd just call me put her in a clinic room and call me into the clinic because she wouldn't see the dentist. She was like, I just want to. I mean,
Yes.
that
It's
relationship
Andrea's my lady.
with the patient had well and truly broken down. She's like, no, no, no. Just fetch me Andrea. Andrea can sort it.
She'll sort it. She
Yeah.
knows me.
Dentist
But
is like,
that's
well,
why communication is so important, isn't it? And that brings us back round to that, is without having good communication, these massive restorations or even simple restorations don't work as well.
and when you're
It's
spending a
having,
lot of money on it, it's got to be
I
right
think
for us
I
to.
think listening as well and taking on board what other people are saying and being open to changing things if you need to change things. And that's on all sides, because we can have that communication, can't we? But it doesn't necessarily mean it's going to be good communication. It needs to be good communication where we're all open and listening,
yeah,
and we can work through some complexities together and get to an outcome that we're all happy with,
That's it.
especially the
Like,
patient.
communication works both ways, isn't it? It's not just about you
Yes.
going in and talking at somebody.
No, because you don't want a technician going, oh, you need to do it this way, and a dentist going, no, we need to do it that way. Because that's communicating, but it's not effective
yeah, but
communicating.
it's also understanding that sometimes you're just not matched to work together.
It's,
And
yes.
that's okay. It's okay to just go, do you know what? Actually, we don't mesh, we don't gel well as technician and clinician. I think you'd probably be better off with another technician doing your work. There's nothing wrong with saying that.
No.
It's just like we're not all meant to be friends. We don't all get along, and that's
Well,
okay.
it's the same, isn't it? You've got friends, and then you've got in that group, you've got friends that you will talk to more. Some that one will be your best friend, but it doesn't mean you like anybody any less. It just means you gel with someone a lot better and they understand you more.
Yeah. And if you're constantly at lockerheads, then nothing good can come out of that.
Everybody is a
You know.
Nothing but a
No.
punch up.
No. But yeah, punch up in grey hair, you know.
So let's get on to software. You are proficient in many different softwares. There's Exocad, and you do the RealGuide, and do you say Zirkonzahn as well?
Yes, yeah.
3Shape?
I've dabbled. I dabble in a bit of 3Shape, but I'll be honest, it's not my favourite.
It's not.
Now,
Well,
3Shape's
this was
going to
my
write me off.
question.
They're going to disown me, aren't they?
What is your favourite software that you like to use?
Exocad.
Yeah.
Exocad, hands
And why
down.
is that?
I like the way that it works. I like the fact that, you know, I use Exocad for 90% of the stuff that I do. RealGuide is what I use for stackable guides, but everything else I do on Exocad, purely because I like the way that you can jump in and out of it. You can jump in and out of the wizard. So I originally started learning on Zirkonzahn, which is basically Exocad. So Zirkonzahn got their formula from, and Exocad designed the modelier for them. They've now come out with their own, which is the modifier, which I've played about with a bit, but it was a brilliant bit of software. But the dongle that I have now is Exocad, basically. But yeah, with 3Shape works in a linear timeline, so it takes you through all of the stages, which is great. But when you get the circle of doom error code, when you've
crashes,
spent hours designing something and you just want to take the baseball bat and beat the absolute bejesus out of your computer because
it's frustrating. It's a good software, but
just there. You know, it just makes me want to throw it out the window.
Thinking, I haven't saved it for the last half an hour as well. I could have saved it every 5 minutes.
You know, you kind of got to go back through the stages and see if what's happened. Whereas, don't get me wrong, you still get the circle of doom with Exocad. But what I like about it is that you can jump in and out of the different parts of the wizard, and you can go. And I find that it's not user. Well, I mean, it is user friendly. Definitely, both of them are user friendly. To be fair, but for me, I like the way that it behaves. I like the way that it allows me to do certain things. It is a really, really top piece of software.
For a new technician, how steep is that learning curve for Exocad if they've not done it before?
So there's two different thoughts on this. If you are a technician with a huge amount of experience, then the learning curve isn't as steep. So, I mean, I am a Luddite, to be honest. Like, I was not computer literate. You know, I still, to this day, if you ask me to do, like, I don't know, an Excel spreadsheet, I come out in hives because I'm like, what? You know, so for me, the biggest thing was, oh God, am I going to be all right with actually figuring out how this software works? But because I know teeth, actually all I had to do was figure out what the controls were and how the software behaves.
And there's a lot of controls on Exocad, to be fair. And I think even when I was still training on it and learning it bit by bit in my spare time, and you know, I even asked, what's the expert mode for? If you've got a normal, because you can do a next screen kind of thing on the Exocad, can't you?
Yeah, so you can go in what they call the wizard.
Yeah, when I talk to the CAD technicians at my workplace, that expert mode. What's all that for then? So there's a lot. There is a lot in there, but I do find that at our workplace they prefer Exocad as well. How long does it take you to actually learn that? Then, would you say?
I'm still learning, but it's like teeth. I'm still learning. You know,
Yeah.
I will never stop learning because there's always new advances. They're always doing updates, but actually learning how to use the system, I would say probably a week to learn what the controls were, and then a good couple of months to learn what different things do what. And actually you can do this.
Again, was that by making mistakes first as well?
Yeah, massively. Making mistakes and going,
Would you say, is there another software that you'd recommend technicians to start on or not?
I would say play about with them. Because again, what's good for me might not be, someone might think that 3Shape is a lot better for them. And again, it's a really intuitive, excellent piece of software. That's the thing with these top tier softwares, they are all pretty much at the top of their game. But it's just like how, as a ceramist, you choose your brushes. There will be certain brushes that you'll use that are good for certain bits.
Yeah.
And then there are other brushes that you use for others.
I use 3 different brushes just for staining.
Yeah, precisely. So it is about, I'm a great believer in looking at what other people are doing and then adapting it to what feels comfortable for me. And with these softwares, like, you're saying there's a lot of controls for Exocad. There is, but then it becomes muscle memory. It's just like driving a car. My 2 fingers go for control and shift now. That's it. I've got one hand on my smart mouse and the other hand on control and shift, and it just becomes part of you. It becomes part of that flow.
I know you're not in a lab kind of working with materials now, but is there a material that you feel is kind of like leading at the minute, or that you're excited to see what comes of it?
I think the way that materials have advanced is fantastic. You look at zirconia, take zirconia for instance. When that first came out, it became like the devil word to dentists. Oh no, I'm not having a crown out of zirconia. No, it's flat. It's disgusting. It's horrible. But you look at the ranges of zirconia now and the different translucencies and shades and properties that are in them, you get some beautiful restorations. I know some guys that are doing zirconia veneers, and there'd be a lot of people that would be like, a veneer out of zirconia? No, they just look horrible. But they don't. They can actually look really stunning.
We've done some.
Yeah,
They are.
and I think, again, but it's understanding your materials. Acrylic wise, there are some really good, pourable acrylics that are just as strong as high impact heat cure, and they shouldn't be tarnished with the brush that they had 10, 15 years ago. There's been massive advancements with these sort of things. But again, it's about understanding that things progress and not being scared to try something new, and actually just allowing yourself in the lab to do a bit of beta testing with these materials, finding out what works for you. You've got people that love GC, and then you've got people that love Myo. And, it is just about finding the material that gets you the good results, that are reliable and that work for you.
Yeah. I mix materials all the time.
Yeah, why not? Why
Yeah.
restrict yourself? These materials, as long as they bond together and they harmonize, then what's the problem with using something, that
But that's
is from
utilising
different
our
places?
expertise, isn't it? To know the materials, to understand the materials, understand how
Yeah.
they all work together, how they complement each other, how that will work in the oral environment, with the strengths, the weaknesses. So to be able to actually get all those different things and go, actually, this combination would be great for this, or let's give this a try. Having that highly specialised knowledge is what makes us who we are, isn't it?
Yeah,
Yeah.
100%. And like I said, that's, one of the biggest reasons why I talk to all of my colleagues about why they're using certain things, because it makes me understand the challenges that they might face, because there's a lot of cases where they do cross over. Say you're having a denture made with crowns, you've got then 2 different materials where you've got either, if it's milled, it's PMMA, if it's printed, you've got printed resins, if it's stock teeth. These are all different materials that all have different translucencies that you're then going to put up against a crown, which is a different material with different translucencies.
And they want it to look the
So,
same.
yeah,
And it's a
but
challenge.
yeah,
And even as you were
100%.
saying earlier about the differences in the strengths of the materials,
Yeah.
if you're having an opposing So if you're having an acrylic opposing a crown, a fixed crown that's made in a completely different material, what's the wear going to be on that? How do you make sure? How do you plan the contacts and stuff for the maximum benefit? Or do you even go, actually, that's really not practical because, and then they have to come up with a different solution? So we don't
Well, I mean, it was like the consultation that I had this afternoon with the dentist. Our default is to go for a fully monolithic zirconia bridge on tie bases, but he's planning on doing a 3-to-3 composite build-up on the lower. Now, composite against a fully fledged zirconia bridge isn't going to last 2 minutes. So I said to him, what we've got to look at is the different definitive bridge. You've got a few different options. You can look at crowning, instead of doing composite build-ups, actually crowning the lower teeth and then having that against the zirconia bridge, or you look at doing composite build-ups, and then what we would do is a taco style bridge where you would have a metal reinforcement and a PMMA taco sleeve over the top. And that also then gives you the flexibility of if at some point you do want to do it in zirconia, because I don't know, the patient's lost their lower dentition and actually then they have that fully restored, you can then do zirconia against zirconia because you can swap them out.
They do even have materials now. I don't know if it'd be any good, but they've got hybrid materials, haven't they? So they've got like a composite that's infilled with ceramic particles, such as I can't remember the name. Is things like, is it graphene? And is that one of them?
Graphite.
Graphite.
Yeah. You've got the composite 20 has ceramic particles in it.
Reinforced ceramic particles within it. And you can actually pop that in the furnace as well, can't you, to a certain temperature? Which is very useful for a composite, actually, because normally if you stick a composite in the furnace, it's disappeared.
Yeah, it's black.
It was in there, and then it's not. It's completely gone.
Yeah, but again, it's looking at all these new materials. It's if you can, it's going to these dental shows. It's talking to all of the different suppliers, and actually really listening to what they're saying, not what they're trying to sell you, but actually what's in it and what's going to work for you. Thinking about the cases that you do, thinking about style of dentist that you have, and what is going to make your life as a technician just that little bit easier.
Yeah. Just before we get to the end of our podcast, I just want to quickly go back to the RealGuide and your implant stacking. And your implant planning. How do you find that? Do you find dentists get on with that okay? Because I think in my experience, what we've seen is some dentists are a little bit iffy about the stackable guides and want to just kind of go with one and then do the rest of it themselves. So how have you found that challenge? When you said that, when zirconia first came out, dentists were like, no, we're not touching that. And I kind of feel like we might be at that point with these stackable guides. How do you find it?
Yeah, I mean, I think one of the biggest things is, I've been watching these surgeries for over 15 years now. So when I first started, they were all freehanding it, and we were making them clear copies of the prosthetic envelope for them to know that they're on the ridge and where they're going. But I have to say that working with Guided Smile, it is an extremely reliable, predictable system. And I think that is why Guided Smile are becoming so successful, or are so successful. They have a huge customer base in America, and we are obviously the UK and European representative for that. And we do have a huge customer base because it's making their life easier. It's not going to be for everybody.
No.
Because there isn't one thing that is for everybody.
No.
You're going to have some people that like it and some people that don't like it. I know that there are some dentists that find it a little bit barbaric because you've obviously got to fix it into the patient's jaw, so they find that quite invasive, which again, I totally understand, but it's about what, the pros and cons, what outweighs each other.
Yeah.
And I think through my experience through doing the stackable guides, what the dentists are finding is that reliability and that predictability is what they're looking for. And with the guided smile system, it is a patented system. So the way that they've kind of constructed it and thought it out is very methodical, very reliable, and it works very well. So it also means that the dentist doesn't necessarily have to worry about having a technician on site, which can be very expensive. I used to do chairside pickups, and, I know that the dentist was having to pay in the regions of about £1,500 to have me there because, I got it from my boss's point of view. If I'm out for the day doing a pickup, he's losing my hands at the bench, and that has to be accounted for. So it's kind of all of these things of the dentist trying to make it easier for themselves. So if they can have the predictability of actually a carrier guide slotting onto their fixation base that will carry that prosthesis for them to be able to pick the temporary cylinders up in, it's
Can you just
very
explain
good.
quickly in simply terms how that stackable guide works? Because I should have asked that first, really.
No
For
worries.
anybody that
So
doesn't know what
basically,
stackable guides are.
you start off with a pin guide. So that pin guide goes over any teeth that are remaining. That pin guide is just a resin guide that will slot over the teeth for placement. And then slotted into that is what we call a fixation base, which is like a metal bar that goes around the ridge. That metal bar is then pinned into the patient's jaw. The pin guide is removed, and then you have 3 slots. I designed them with 3 slots, and each different part of the process is then slotted in and taken out. So once that fixation base is in there, the teeth are then removed, the flap is open, the ridge is exposed, and the dentist will put on the osteotomy guide. Now, the osteotomy guide is basically where you've got the sleeves to be able to drill through. You do your pilot holes and you drill through and you place that implant. And it also gives you a level to where you need to do your bone removal if you're doing an FP3, for instance. Once you've then placed the implants, you use something called a carrier guide, and that carrier guide will help you then, if you're using angled implants, it will then help you with the rotation and where to place and what degree that angled abutment needs to go. And then once you've got your abutments in place, you then use the carrier guide with your temporary prosthesis on it, and you backfill and inject in material around your temporary cylinders to pick up. You then take that off, trim it up, and make it a nice, neat temporary bridge, basically. So it's every stage from tooth extraction through to fitting the temporary bridge, all in a stackable system, basically. So, but because it's all been designed together and the implants have been precisionally placed in the CT scans in RealGuide, everything that is being planned that you see on screen is now being put into place with this stackable guide.
It's quite fascinating, isn't it? Because it's kind of opened up a scope for technicians there with the RealGuide, that they can kind of have a little bit of that clinical side with that, because they've got those CBCT scans and they can see the bone and they know where to place, they can see where they need to place those implants, but you really need to know what you're looking at to be able to do that, don't you? To be able to understand how to read those scans that are sent through.
So when you're reading a CT scan, it is completely different. You need to be very aware of the vessels, the nerves, the sinuses, everything. But it's opened up that, there's a massive taboo thing about digital at the moment, and especially AI. And, as technicians, are our jobs going to be taken? And again, I don't believe that's the case. I believe if you move with the change and you move with the industry, then new opportunities are going to become available to you. And this is a prime example of a new opportunity. We now have technicians good friend of mine, Lola herself has moved off of the bench, and we work very closely with one another. I do the temporary setups. I then give her that temporary setup, and she is an implant planner. That is her full job. So she's gone from working on the bench using the tools to now she plans big, full on, all on X surgery cases every day. So again, it's, there will be certain things that technology will take over, but in an industry with a diminishing amount of technicians actually coming through, we are going to struggle massively. So we kind of need automation to come in certain ways to do certain aspects of the job that we just don't have the hands and manpower to do anymore. But it's opening up new opportunities for you to learn something different and kind of move around in the industry and learn new skills,
Yeah. So on that, you've already mentioned the AI. As a final question before we end this podcast, where do you see dental technology then in the next 5 to 10 years, including the integration of AI with design and diagnostics?
So, I think it can be a really exciting time. I think it can be a really opportunistic time for people as well, but it's about going with it. And it's about reading the industry and where it's going and not being afraid to learn new skills and not being afraid to make that shift. It's one of the reasons why I've gone into the digital aspect of it, because I could see where the industry was going.
Do you think that's what technicians will need then in the future, some more digital skills?
I think, I definitely don't think it would be a bad thing to learn. You're always going to have people that are required to actually give it that human touch and do the finishing off aspect and giving it life. Design and machinery will produce it, but somebody needs to give it that life.
Yeah.
Somebody needs to give it that natural flair. And that will be the architecture and artistry of the technician. So for me, like I said, I class myself as a multidiscipline technician now. I don't just I don't just pigeonhole myself as a prosthetic technician. When I was still in the lab, I was dealing with the full arch cases, but I was finishing them off in acrylic and I was also finishing them off in zirconia. And then I started to teach myself how to do all of the green state trimming and all of the green state staining, to then I was going to look to move on to how I would do the staining and glazing side as well, because I feel like all of these skills are going to be necessary skills as we
Yeah.
move on into the future. And I think if we look at it through the right way, we can see that it's actually going to be a really exciting time for the industry to change, but change for the better, because we're not running out of patients. There's always going to be people that need teeth, but what we are running out of is capable hands and people with that imperative foundation knowledge. We are losing technicians quicker than we can replace them. And that's leaving labs in a really short-handed position.
Yeah.
That they're going to, massively struggle, which in turn the technicians are then going to struggle. There's only so many hours in a day. So if we can get to a point where actually the more process can be done by machine than a technician being taken away from something that's very technical, then I think from a business perspective, it makes sense. But I do also appreciate why, from a human aspect, people would be cautious and very scared of that
Yeah.
and have a kind of like negative view towards it. But
I think there's still room for, even if digital was to take over all the CAD side of things, there's still room for finishing of things. We always, like I said, we still need people to hand finish things.
yeah,
So
yeah. And, no matter how clever AI gets, yes, it might be able to design and posterior crown or even like a small unit bridge or whatever. But it's not going to get to the point where it's doing full mouth restoration. Not yet. anyway, the machines haven't taken over just yet. You are going to need skilled and knowledgeable technicians sat there designing, and you're definitely going to need them sat there giving these prosthesis life.
Definitely. Right, I think we'll end it on that note, and really appreciate you coming on. It's been a really enjoyable chat. Anything you'd like to say, Andrea? Any questions before?
Just that it's always a
finish?
pleasure to sit and listen to Julia get super nerd. It's
I know.
Her level of knowledge is just outstanding, and I don't do crown and bridge. I haven't done pretty much any of the stuff that you guys have been chatting about because I'm predominantly ortho and dabble a little bit with the denture work, but it's ortho and bits and bobs of the surgical stuff. But
yeah, but Andrea, I can't bend a wire to save my life, love. Honestly. Don't ever give me a pair of pliers to do anything wire related.
No, but honestly, Andrea's right.
It was fabulous.
You're full of knowledge, and it's been great to listen to. That we could have let this go on and on and on, but we would need to stop it somewhere.
I could talk for hours, girls, but no, thank you very much for having me. It's been a pleasure.
Thank you for coming on. Take care.
Take it easy.
Bye.